Namaskar. I am Dr. Raj Shankar Ghosh, Senior Advisor Vaccine Delivery from Bill and Melinda Gates Foundation. Today I am here in Madhya Pradesh to speak about the COVID vaccination program in the state. As we know, Madhya Pradesh during the initial outbreak of COVID had one of the largest number of cases in the country. There were massive outbreaks both in early 2020 and during the first quarter of 2021. But the state responded back with very good control measures, and one of them is COVID vaccination. Today, the state has achieved very high coverage with the first dose of COVID vaccine almost reaching 94%, and with the second dose also the coverage is picking up. Today I have with me Dr. Santosh Shukla, who is the Director of Immunization, the State EPI Officer of Madhya Pradesh. He is a colleague whom I have known for many years. We have worked together in the polio program, and he has been one of the exemplary officers in the immunization department across the country. I have the pleasure and honor to present Dr. Santosh Shukla, and we will hear from him the story about how public health triumphed in Madhya Pradesh and the COVID vaccination program was conceptualized, planned around the people of the state. So Dr. Shukla, welcome to this conversation today.
Thank you, sir.
First of all, I would really like to congratulate you and through you to the entire state and its people for the excellent accomplishment that you have achieved in COVID vaccination in the state. Now, one of the striking features of Madhya Pradesh is how you have really built the program, keeping people in the center of your planning, of your policy, and of your program. So what I would like to hear from you as to how you converted the COVID vaccination program into a people-centric program in the state.
Actually, I have been associated with immunization right from the birth in UIP, Universal Immunization Program in India, since 1985. And out of experience, I have this knowledge that immunization cannot be a forced need. It should be demand-based. So when COVID vaccine was to be introduced 16th January 2021, we had planned earlier. We created a demand in the state, and whenever we go into the mode of some campaign, because Madhya Pradesh is known for innovations, so we have done many communication development schemes in the state, and one fruitful was we take oath, and oath is taken right at the chief minister level. He signs the oath, that there is a format for oath. It is signed by him and the health ministers and additional chief secretary, and now it is circulated all over the schools, all over the state in different areas, different departments. And oath ceremony is added by taking some audio video messages also of the celebrities. So there is a huge message delivery system. We have got video conferencing system, all IT support, social media, all is charged with messages of our chief minister. He's a very popular figure in the state, and we use him as a brand ambassador. So once the demand is created, and this time we had the backup of Corona epidemic. During the Corona epidemic, there was some crisis management committee. That committee is constituted by public health leaders right from the villages up to the wards, and they collaborate with the NGOs, with the officials, and they are acting as a very good team. So that platform we utilized in COVID vaccination also, and there was a huge demand initially when January 16th vaccine was launched. The demand was so high that we have to close the vaccination center because that time the scarcity of vaccine was there. One thing I want to bring to your notice that when vaccine landed at airport, I was the person who welcomed the vaccine, who received the vaccine, and that scene was outstanding. The vaccine was welcomed in the state as a celebrity for the first time in the history of my immunization, travel history of immunization. I have never seen a non-living object being treated as a celebrity. And that day I thought the success ought to be there in the state. And for keeping those vaccines intact, because we had target of 5 crores 49 lakh citizens in the state, so we had planned well in advance with the support of CHAI. We calculated the cold chain space. We had borrowed some equipments also, ILR, deep freezer, WIC, WIF, all were installed before. Training was done well in advance, all type of training. It was cold chain training, it was inoculation training, it was communication training, all sort of planning was done, and it took long 4 months. Preparedness was there. So what you are saying that you made this citizen friendly, yes, because this was unique vaccine in the sense that previously 12 vaccines we are using in the state in mother and child program, they were actually used at the Anganwadi centers and in the health institution. But as per Government of India guideline, there should be 3 rooms, 5-member team. So we had to take a extra space, and then we switched over our COVID vaccine center into schools, into Panchayat Bhavan, into different institutions. We took support of Lions Club, Rotary Club, and IMA, and all private partners, they supported us. And that way we could create the space. Then it was first time in the history of Indian immunization that it was transferred to IT-based. COVID app was formed and pre-registration system was there. So again, a training of data operators was to be given, and arrangement of computers and printers and all those logistics were to be there. And because we were introducing into the 18 plus, first time in the history, 18 plus citizens, that too in crores. Previously in the mother and child health program, our target was only 20 lakhs only. So 25 times larger cohort is to be vaccinated. And then the vaccine availability, because it was new vaccine, it was in the emergency trial basis that was introduced. So lot many documentation we had to exercise before giving vaccine. So those challenges we met out. But when we created an atmosphere for the public, the management of crowd control was terrible actually. And we had to take the support of police also. This is first time that our vaccine was escorted by police persons at the stores and at the COVID vaccination centers also. I am thankful to my citizens. They kept them cool. Then the challenges were how to get vaccination done of our senior citizens, 60 plus, yes, and those who are handicapped. So we designed a near-to-home vaccination approach team. They used to get a call. We developed a toll-free numbers 1075 and 104. We used to get the calls. Please help us. We cannot come to long distances. Please help us. So near-to-home vaccination centers, they helped us. Then we developed mobile teams through using our ambulances, and that helped us diffusing the load actually. Right. Our workload was in routine immunization, our workload comes to nearly 20 or 25 children, but it was 250 to 500 workload was there. I salute my vaccinators and the verifiers. They never succumb to the pressure of the demand, and they continued till late night, since morning till late night. And our challenges initially was that we should provide the vaccine to as many public as possible because of the constraint of the supplies. But when the corona second wave came, the scene, it was 360 approach in the demand. Mm-hmm. Everybody was fearful because not of the vaccine, but there was coincidence. What happened actually? They were in contact. Every third or fourth was having positivity rate was very high. They were coming for vaccination. No symptoms were there. When we vaccinated after 4 or 5 days, he developed or she developed a positive, case, and then the complications occur, and some deaths were reported. Coincidentally, it was communicated in the rumor form that it can kill the persons who are vaccinated. And that big challenge, how to counter this challenge. So we have developed a telecaller system in the state with the support of UNICEF, and this is being exercised last so many years. And we have developed a direct rapport with the ASHAs and the ANMs. We call them in those areas which were very resistant. We got the reasons, what are the reasons prevailing over there? And 20 reasons came out. I developed the answers, and that fact sheet was frequently asked question answer for removing all type of rumors, for all fear complexes which was among the public. And first time we approached to the Department of Education. I contacted the Principal Secretary Education. I asked him that I want support of all the collegiate students. They are 15 lakh in number in Madhya Pradesh. So we had a webinar of all the 1200 principals in the state. We trained them on the guidelines of a frequently asked question answer, and we asked their help that you should pass this virtual classes to your student. And we developed a brand ambassadors of 14.5 lakh in the state. Then the challenge was how to vaccinate them, because it was pre-registered vaccination system. There was no offline system. So we created a group of ministers in the state under the chairmanship of Health Minister, and that clicked very well. You know, the program of immunization in the country is run by guidelines of Government of India. But Government of India has given one line to us to exercise is you can innovate anything which is required for the betterment of the program. So that line we picked up and used it very well, and we listed 18 type of categories of persons who are working together in families. Means somebody is coming as a barber or gas person, anybody, vegetable man, fruit man. So we listed those, and we got them vaccinated near to the societies wherever the population was residing. So that clicked very well. And lastly, in the tribal area, the rejection and refusal was so high that we had to found a new way, and that new way was there is a program, Rashtriya Kishore Swasthya Karyakram in India. Teenagers are working as a volunteers, and they are very energetic boys and girls. Each village has one boy and one girl. They are called Satya. We used them in the vaccination program. First time, I arranged a webinar, sounded them, what is the benefit of getting vaccination, what is the side effects of the vaccine, which was almost nil. And we also said to them, if you get yourself vaccinated, you will be example to your family members that nobody is dying of vaccine, nobody is getting any further infection, and the positivity rate will go down, the death rate will come down. So that advantages was told to them, and when they got themselves vaccinated and they showed themselves to their family members, no, it is not harmful vaccine, it is useful vaccine. So the mindset was changed through the students, those volunteers. Later on, when the schools opened, we used that school boy program also. In the Pulse Polio, you had also seen when we were passing the message through homework that please come with your children under 5 and get them vaccinated at the booth for polio. Do Boond Zindagi. Every student was bringing their younger boy and girl to the booth. So that scene I remembered, and I introduced in COVID vaccination also. Only thing was, Papa Mummy bhul na jana, apne khud ko teekaakaran karana. The slogans were changed. As per need, we designed first dose campaign. By 30th of September, we target that we are going to finish all those first doses by 30th of September. That was call of Chief Minister. So what we did was, we introduced pregnant women and lactating mothers vaccination in the state on 23rd of July. And because the data bank was with us of RCH portal, we utilized that data bank, and believe me, in that last month, we could vaccinate 1.5 lakh pregnant women. And that gave us a jump over the Tamil Nadu, which was ahead of us, and we were the country topper in pregnant women. So we tried all those good practices which we were having already done or we could initiate. One was one new thing we did was that there was lot many huge lines were there before the COVID vaccine center. We wanted to reduce that load. So what we did was we created a car-driven vaccination center, and it was first time tried in Bhopal, city capital, and that was across the India also, that was utilized at the international also. So that reduced the tension of our workers, the load was reduced. We could immunize more than 10 lakhs through that car-driven vaccination center.
So, Dr. Shukla, as we hear you and as I'm sure the whole audience hears you, the phrase that we have that public health is best demonstrated in action really comes true to life. One of the things that I would like to ask you is that Madhya Pradesh is such a large state. It's the second largest state in India, and with very remote areas and difficult to reach areas. How did you get the vaccine to every remote part of the state with such machinery and in such speed?
Actually, sir, you have very rightly said, working in national surveillance project in WHO for 10 long years and across 8 states, that gave me a lot of experience, lot of challenges I faced during that period, and lot of lessons I learned. And one was how to travel the vaccine under crisis. And the crisis was, we shifted into Maha campaign, means massive event movement, and it was first time done in the month of June 21st. Believe me, what I am saying is, on 20th night at 9:48 p.m., we got vaccine supply. The extra supply which we needed, because we had created a good demand, and we thought we should have an extra vaccine with us so that the person should not go back.
Right.
So when at 9:48 p.m. vaccine landed at airport Bhopal, we could plan in advance that how to shift this vaccine, lakhs in doses of vaccine across the state in 51 districts. 1,000 kilometers is Singrauli. Can you believe how we can manage that overnight shifting of vaccine? But we had designed in such a way that there was a relay of vaccine van. All the division headquarters were right at the airport. There is a system of giving a voucher that was pre-filled. In voucher, we have to fill the batch number. That batch number from Government of India, because of the personal contact, I could get them. So everything was ready. Only thing, they have to rush.
Right.
But in the pulse polio, what I had observed, because I was also vaccine logistic officer in the ministry also.
Right, sir, I know.
So that in that as a role of vaccine logistic officer, I had experienced how to control and manage the vaccine, moving vaccine vehicles. So I developed a directory of all the drivers. We were talking to them whole night, hourly. Where are you? You should not sleep. That way, that helped us. That vaccine was at the last mile before 9 a.m.
Excellent, sir, excellent. Now, I cannot end this interview without hearing a story from you. Your stories are real life examples of public health. Tell us the story of how you used Uber to help the senior citizens of your state to get the vaccine.
Actually, last 36 years, I'm working for the cause of humanity,
Right, sir.
saving the lives of mothers and children in the state. I feel myself great that I have participated in the eradication of smallpox 77, 2014 polio eradication, and MNTE, mother neuter tetanus elimination in 2015. Never ever I got that much value that was recognition, that much publicity as I am getting in the COVID vaccine program. I was getting many calls, right from CM House right up to the last citizen of the state. Floods of telephone calls were coming. Out of those, 2 phones I still remember. One was from Uber chairman. He called me and said, sir, please get me vaccinated at any cost, because there was huge lines were there. So I said, yes, I will manage somehow, but you should do some social cause. Can you do that? I got his commitment. He said, yes, I will do. I said to him that what I am observing during my field monitoring, that many elderly persons, many handicaps are there who wanted to get them vaccinated, but there is no support hand available with them. Can you do favor as a social cause without asking any penny from those? That system can be established between you and me. I got a call. I can give my number to all persons, and through me you will get. So he agreed, yes, we can definitely support free of cost travel system. And other was in the month of May and June, the summer sets in India. And I got a call from lady chairman of Coca-Cola company. She said, Dr. Sir, please get my persons vaccinated. I said, yes. Again, same lines, what social help you are going to give us. So she said, whatever you will say, I never want any cash or any kind. I want that my inoculator, my team members, five members COVID center are there. I can provide you the list. You supply I'm supplying the cold chain vaccine, you supplied them cold chain Coca-Cola. So they said yes. So they supplied.
Excellent story. Till now we have been hearing some brilliant public health in action from Dr. Shukla. Dr. Shukla and I have been colleagues in the polio eradication. In polio eradication, we had learned one thing, which is that we must be efficient in what we do. Then came the decade of vaccines in which we had to reach high levels of equity in order to reach every citizen everywhere across the world. The third thing that we also learned was that we must act based on evidence, whatever action we take. The fourth thing that we learned during the introduction of new vaccines and during the system strengthening is that we must empower the community, we must empower our health workers. So these are the 4 E's that we had learned: efficiency, equity, evidence-based action, and empowerment. With COVID vaccination, we have learned one more thing, that is, we must act with empathy. Empathy for the people who we are serving. And these stories that we have heard today are the best examples of that empathetic thinking about the people in our policy, in our programs, and in our planning. It has been a wonderful conversation, Dr. Shukla. Many congratulations to you again.